Which of the following is the most appropriate next step in management? 45-year-old female, history of gallstone, emergency ED, severe abdominal pain, nausea, vomiting, fecal examination, abdomen is tender, bowel sounds are diminished, lab tests reveal elevated serum amylase and lipase, abdominal CT shows changes in the pancreas, patient is diagnosed with acute pancreatitis and started on IV fluids. Her pain does not improve after 3 days. Shows evidence of pancreatic necrosis. Wait, okay. Here are all stones. Okay. Physical exam tender. Elevated serum lipase. Okay. Oh, maybe this isn't so hard. If it's having pancreatic necrosis, we have to do surgical intervention. I was thinking they were going like, okay, is this going to be like head or tail type intervention? But they're not asking that here. If you're showing pancreatic necrosis, yeah, you have to get that out. If it's necrotic, you have to get it out. So I would do surgical intervention. Oh,
Okay, so
okay.
let's kind of see kind of what's going on here. So it's kind of
Okay.
interesting. I actually probably would have leaned a little bit towards surgical intervention too, but let's see kind of what they say. Acute pancreatitis, severe disease and complications like pancreatic necrosis, early enteral nutrition is to provide nutritional and reduce risk of infection.
Okay.
Superior periental and nutrition in these patients as it helps integrity. But let's see,
Okay.
surgical interventions usually such as infected pancreatic necrosis,
Okay.
persistent organ failure, hemorrhage. In this patient, there's no indicated surgery. So if you look at it, right, so abdominal pain, nausea, vomiting, but it doesn't seem like patient has what is it called? Patient doesn't have like infection on top of it. So that's
Okay.
what they're
No,
trying
like
to say,
fever.
right? So
Okay.
the pancreas is quote unquote necrotic looking, right, on the scan, but no symptomatic of sepsis, right? And so things, I guess, in this scenario, they're trying to say, before you kind of open up, if the pancreas is quote unquote dying, but there's no infection yet, then I guess you can start kind of feeding to see if you can wait it out. But it's kind of
Okay.
interesting. I didn't know this. This is a very, very difficult question. So
Okay. That's okay. All right.
once again, probably a lower yield question for general surgery, but kind of
Okay.
interesting to think about. But I think you're thinking in the right terms, right? This is an acute problem. So for me, I would have probably said surgical intervention because of necrotic pancreas. But I guess in this scenario, it's not.